I think that brings us to the patients we see the most, or clients. That 50 to 65, we see them younger, but we've now realized that's probably not the people we're going to really screen. So let's say that 50 to 65. If you're in that age group, who should think about that they might need a Dexa scan? So what would be the risk factor, or the main, let's say, 5 risk factors for someone in that age group to need a Dexa?
An important risk factor is family history. It has a really strong influence on your bone health. So genetics play a major role. So if there's a family history, that would be a really important one. Metabolic diseases are really common. So if you have diabetes, type 1 or type 2, it is definitely an important risk factor to bring into this equation. And then other autoimmune diseases, especially like rheumatoid arthritis, is really a major risk factor. Any other neurological conditions like patients with Parkinson's disease or poor mobility after strokes or muscular conditions should be included in this equation. Inflammatory conditions, gut diseases, inflammatory bowel disease, celiac disease, malabsorption conditions. And then I think very important is patients with special dietary preferences, and especially vegans and vegetarian patients, because there are important gaps in their diet that puts them really at risk for poor bone health. So there's actually a very long list of health conditions. I think the other one that I just want to mention also is medication. There are quite a number of medication that can play a role. PPIs, the proton pump inhibitors, anti-acid medication, there's a definite link with poor bone health with that now. SSRIs, the antidepressants, there's a strong link. Chronic opiate use has been strongly linked with that. And obviously any patient who fall easily due to whatever reason, because I think falls is part of the package of risk factors. So those are a few important ones.